Deep Brain Stimulation or DBS is an FDA-approved procedure for tremors, Parkinson's and epilepsy. More than 160,000 patients have benefited from this procedure worldwide. However, the knowledge about DBS in Indian patients is still very less. Hi, my name is Dr. Raveesh Sunkara. I'm a neurosurgeon at Arete Hospitals, Hyderabad. Let us understand DBS with an example of Parkinson's. It is one of the most common conditions treated today with DBS. Parkinson's is a degenerative condition of the brain and the nervous system. Patients usually present with motor symptoms like stiffness or difficulty initiating movements or with tremors. The meaning of progressive being these symptoms keep getting worsening over time. Patients usually come to us and get started on some medication. However, there is usually a refractory phase where these medications stop working. This is when the neurologist usually puts them on additional medication, and this keeps repeating as a cycle. A lot of times, patients end up taking 4 to 5 different kinds of medication and start getting side effects of this medication. Slowly, the disease progresses to non-motor functions such as difficulty in swallowing, slowing down of thinking, and a lot of other problems. The medications given in Parkinson's are usually designed to replicate the neurotransmitter called dopamine. But like I said, it comes with a lot of side effects after taking multiple different kinds of medication. This is when the option of DBS is given. Deep brain stimulation is a surgical intervention in which we neurosurgeons implant an electrode into the deep brain. This electrode is connected to a device that is placed beneath the skin in the upper chest area. You can think of it like a pacemaker for the heart. With these electrodes stimulated, the neurologists are able to directly intervene the circuitry that is damaged and causing symptoms of Parkinson's. To give you a very simple explanation about how this works, think about electrical circuitry in your house. Say if one particular line in the house that is supplying to your kitchen goes off, that doesn't mean that entire house the power is down. And what we do is we repair this particular circuit that is supplying the electricity to your kitchen. In the same way, DBS electrodes are able to either overstimulate or understimulate a particular area in the brain, thus helping us re-establish the circuits that are responsible for causing the symptoms of Parkinson's. Now the next question is, who is the suitable candidate for DBS? Now, this is a very complex question and is usually addressed after a series of consultations with our neurologists who are involved in this planning and neurosurgeons. But the most simple dictum is, it is usually the option given for refractory cases of Parkinson's, that is, in which the medications are not helping or the medications are becoming so detrimental that the side effects become too much for the patient to handle. So what is the process of DBS? When I say process of DBS, you have to understand that deep brain stimulation or DBS is not a single day surgery. Once your case has been thoroughly studied and decided by the team that you are a suitable candidate for this procedure, you are called in for the surgery. On the day 1 of surgery, we usually implant this electrode into the brain. This procedure is usually done as an awake surgery. Why awake? Is because we need to understand the exact placement which is at millimeter precision in the brain. During the surgery itself, we are able to understand whether your tremors are coming down or not. Once the electrode has been implanted into the brain, usually you are discharged within a day or 2. You might experience a small bump in the head, but you don't have to worry about it. After a week or 10 days, once this wound has healed, we call you back in for the surgery to implant the pacemaker or the stimulator. This stimulator is implanted just beneath the skin in the upper part of the chest and connected with the wires to the electrode that has been placed in the earlier sitting. This surgery is usually done under anesthesia. Once you recover from this surgery, you're sent home again within 2 or 3 days. And then you are called back to the department of neurology or neurosurgery where the modulation starts. This is usually done almost after 15 to 20 days after the implantation of this complete device. The neuromodulation with the device is usually a trial and error process, and it is fine-tuned to a level where the tremors completely come down and your dependency on medication becomes very less. Currently, we are seeing almost 60 to 80% improvement in patients with refractory Parkinson's symptoms. So, if you or your loved ones are suffering from this disease and have been having a lot of side effects using medications, it is really advisable to seek the nearest professional help where this DBS surgery is available and understand if you are a suitable case for this procedure.